Hey everyone. Hi, my name is Heather Madison. I'm from the National Center on Subsidy Innovation and Accountability. And welcome to the 8th session of the Let's Talk About Alternative Methodology series. This session focuses specifically on the requirement for state and territory lead agencies in crafting a report on childcare price and cost data. It's also called the detailed report, or the market rate survey, or alternative methodology report, and the narrow cost analysis. We are happy to bring you this series in collaboration with the Office of Child Care and the National Center on Early Childhood Quality Assurance. And I have a few housekeeping items before we get started. The call is being recorded and will be made available to anyone not able to participate today. As participants, you can turn on your video and unmute yourself. We do ask that you remain on mute and use the chat to ask questions and make comments. And we will be collecting questions and answering them throughout the webinar. If you are not able to use chat to ask a question, we will have opportunities for you to come off mute to ask your question. You can turn on closed captioning at any point to assist you. This webinar is part of multiple resources to support you in the use of cost data. At the conclusion of the webinar, you'll receive a link for an evaluation, and we encourage you to complete the evaluation and let us know what worked and what can be improved. We do read every single evaluation response, and so we do use that information. So our agenda today is we're going to introduce our speakers, our guests today, and then we're going to jump right into the different components of the detailed report, the market rate survey or alternative methodology results, the reporting on engagement, the components of the narrow cost analysis that must be included in the report, some additional data that is required to be in the report, and lessons learned. Today, our guests are Rebecca Ulrich and Alex McPherson from Virginia Department of Education, and Nina Johnson from the Early Childhood Quality Assurance Center. Thank you, and I'll give them a little bit more time to introduce themselves as we get into the webinar. So after this webinar, you will have a checklist and some strategies to use when creating your detailed report. So just to get us all started in chatting and getting practice finding the chat, if everybody can just jump right into the chat and share what you're looking forward to in the spring. I realize spring happened technically 2 days ago where I live. We are getting a big snowstorm this weekend and it's below freezing today, but spring is coming. It's got to. So please jump in and share. The spring flowers. Oh, hiking. Yes. Just the warmer weather. I would like above 55 would be a lovely temperature. And gardening. Baseball. Getting outside. You see, a lot of people are definitely in the weather, warmer weather, snowshoeing in 60 degrees. Oh, that would be lovely, Andrew. Once it hits 60 degrees, the only place where I live that you can snowshoe is in the very top of the mountains. Outdoors with allergy mats, spring clothes. That's awesome. Well, thank you, everybody. And I'm looking forward to other responses. Those are all great things that I know I'm looking forward to as well. So we're going to jump right in. And the way we formatted this is we do have some checklist items to talk about in each of those components I shared, and also some items that you might want to include in your report that are helpful. We're going to start with the components around your market rate survey or your alternative methodology. So these items can help you with the market rate survey portion of your report. None of the components need to be lengthy, and they can be summaries of information. It can be really helpful to actually have it as summaries of information so that it's easier for some to be able to read the report. It should be clear how your data represents the childcare market in your state or territory. For example, do you have family childcare homes, licensed centers, out-of-school time providers as separate programs? If you do, you want to capture their data and report by those program types. You want to summarize how the data is current, complete, and collected in a rigorous manner. Rigorous means that the lead agency uses multiple methods to ensure the data is collected from a high percentage of providers or a high percentage of the people that are represented. And you need to report any relevant differences, such as geography, age of child, provider type, and quality of program. So these are components that are helpful when looking at your CCDF plan. They're also helpful to include in your detailed report. It is actually helpful if you include it in the report, then it can be pretty easily transferred right over to your plan or other materials that you're sharing with partners and providers or policymakers. So you can make your data comparable to the subsidy rates, makes it a little bit easier to do an apples to apples comparison. And if using a market rate survey, you want to include the rates at the 50th, 60th, and 75th percentile. So we Massachusetts wanted to join us today, but unfortunately was not able to. However, they did share some examples with us that we're very grateful for. They completed a market rate survey and a narrow cost analysis in 2022, and their report includes many of the components we'll talk about today. This slide is an example from their 2022 report on how they report the differences in price percentiles across geography. They created a visual for the rates that fell below the 50th percentile with the red highlights, as you can see on the screen. This visual supports a quick review by partners or policymakers on the areas where you might want to target some rate improvements. So now we're going to move over to talking to Rebecca and Alex about how they approach their detailed report. And I think we want to start first with just, what did you do? Did you do a market rate survey? Did you do an alternative methodology? Who prepared your report? Just give us a summary of how you started the process.
Sure. Thanks, Heather. And thanks for inviting us to join you all this afternoon. We're really glad to be here and to talk about a favorite topic of Alex's and mine, which is our alternative methodology. So Virginia did decide to do an alternative methodology, specifically a cost model that allows us to estimate the cost to meet health, safety, and quality expectations here in the Commonwealth. We worked closely with partners at the Prenatal to 5 Fiscal Strategies. I think I see one of our friends here on the call to develop our cost model, and they prepared the technical appendix for us, which appears in our report. But the kind of body of the report that summarizes what we did and what we found was written by our team in sort of more layman's terms. As Heather is saying, we did quite a bit of high-level summaries, included things like tables to provide bullets around the different cost drivers that were incorporated into our model, to summarize our engagement, as well as to summarize the implications of some of the changes to payment rates that we made. So a couple of primary data sources really went into the development of our model. So first, if you've ever heard anyone from Virginia talk about alternative methodologies before, you probably heard one of us use the term competitive compensation like 100 times. So, when we were thinking about our why here and what we really wanted to achieve in developing this methodology, for us, it came down to supporting educator retention in our sites across the state. And we know that from years and years of survey data from childcare providers and educators across the state, we know that competitive wages are really a driver of retention, and that ultimately you need those stable, consistent educators in early childhood classrooms to get the high quality interactions between teachers and children that we want to see, and that are ultimately kind of foundational to the way that Virginia measures quality through the class tool in our quality measurement and improvement system. And so, given that focus on competitive compensation, or given that all of the survey data that told us that was really kind of what needed to be our focus, that is where we were really focused on thinking about all of the different kind of data sources that could help us to think about what does it look like to competitively compensate educators in childcare programs across the state. We of course use data from other sources, from our licensing database, for example, to help us think about, the sizes of different programs, to help us think about how many classrooms and how many children are being served in our kind of different, how those data sources are going to drive our assumptions as far as program sizes for family day homes versus for centers. And we again worked with prenatal to 5 and used the provider cost of quality calculator as the basis for our model, and really just kind of made customizations to that model in order to make it specific to the Virginia context, to account for our ratios and group sizes, to account for our licensing regulations, and then again to integrate that competitive compensation piece for staff. And we used a couple of different data sources. Ultimately, we looked at a ton of different data sources for compensation, but what ultimately ended up in our model was some workforce survey data that was a few years old, but that we adjusted for inflation. And we used that as sort of our status quo or our baseline set of data around compensation. And then in our high quality scenario, or the way in which we're thinking about the competitive compensation, we took K-12 elementary teacher salaries in each locality. We calculated a regional weighted average for elementary teacher salaries. And then prorated those slightly to account for differences in preparation requirements between K-12 teachers and early childhood educators in childcare settings, and then used those wages to set full-time salaries for teachers in classrooms. And then we sort of used that and we calibrated all the other staff salaries, so directors, assistants, around the lead teacher salary. So effectively what that did was put the lead teacher salary not quite at parity, but comparable, kind of rooted in the K-12 teacher's salary. And then we, again, sort of use that as the anchor around which we establish salaries for other positions in centers and in homes. And so, again, that was really important to us for a couple of reasons. So one, that staff salary, or the K-12 salary data, is a survey that is updated every year by local school division. So the Department of Education collects that data. We know that it's a data source that we can keep current and we can incorporate into our model on an ongoing basis. And it also, just allowed us to kind of establish that that bar where we are, striving towards parity with K-12 over time. Something that was important too for us with the compensation piece is that we were very clear both in our report and when we were publishing information about rates to the field, is that the expectation is not that you have to pay your teachers this in order to receive these rates, right? This is an aspirational assumption, right? This is kind of the direction that we want to support providers to take compensation in their programs. But there was no mandatory change in wages associated with the implementation of our payment rates.
So in the focus of wages and thinking about, right, who uses your report, and especially this message of including those wages in your cost model, but wanting to message to providers, right, that is aspirational. Who were you thinking of when you wrote your report? Who did you want to use it with? And how do you think that they are using it, if they are, or how did you use it with them?
So I can jump in here a little bit. Definitely, we were thinking about a variety of audiences, right? Because, so many different folks come to the state web pages and come looking for these reports for so many different reasons. And so that was important for us to keep in mind. And as Becca said, use layperson language to make sure it wasn't too technical or too dense, so that just about anybody who was accessing the report could get the information that they needed from it. And so, it was really important for us to build background in the report too, and really make sure that we provide that overview of the Virginia context and make it really clear, what our values are, what's driving this work that really underpins all of the alternative methodology work. And so again, as Becca, I think, said really eloquently, making that competitive compensation piece come out front and center in terms of a driver for quality. And when we were thinking about publishing the report and who all might be using it, this formal report was actually the second of 2 publications on Virginia's cost model. And so our 2023-2024 biennial state budget, which directed VDOE to make this shift in approach, which I know, Heather, you've heard us talk about this a bunch. We've presented on STAM panels and other places around the alternative methodology, but that budget directive is a really important part of our story on how we on this journey. It directed us to report also to the General Assembly and the governor our approach and our recommendations for leveraging this methodology to inform payment rates, not only for the subsidy program, but for community-based providers and other publicly funded programs as well. So we had to first make sure we were achieving that objective, right, and complying with all the directives from our governing bodies. And then we developed a second report that is specifically targeted at broader stakeholders and provides more detail on the comparison between the baseline and the default scenario. And stakeholder engagement is super important. Have some thoughts to share there, but I think you have a question on that later on, so I don't want to jump too far ahead there, but happy to talk about that in more detail when we get to that piece around stakeholder engagement. But those different stakeholders that we engage were some of the different audiences that we had in mind when we were drafting this report. And again, both of these reports we think were really critical in helping achieve a few things in Virginia. Underscoring again that this cost-based approach is really the right way to fund programs for publicly funded services. Again, not just subsidy, but setting this bar in child, and again, elevating childcare educators as educator professionals, the same way that we were trying to signal by making that link in the K-12 education space with salaries, right? Building on some shared vocabulary, right? We try to use some of these same terms and phrases intentionally and repeatedly: cost of quality, competitive compensation, reinforcing the significance of those terms. And then ultimately, of course, and I think a lot of people probably go looking for this in the report, right? But what's the what? What was the impact of the payment rate increases? Was that actually at a conference last week, and a policy advocate, pulled us aside and was asking him. He's like, so like, what did the alternative methodology do? Did the rates change? I was like, oh, I should take a look at our report, because of course that's a question that people ask. This is not just a theoretical exercise. This was really meant to make meaningful changes that reflect the cost of quality when competitive compensation is built into your model.
That's fantastic. Thank you. And it is really great to hear about like real life applications that you've used the report, right? Sometimes it feels like you're putting out a report and nobody reads it, and it's just this requirement, and to be able to use that information with policymakers, providers, partners is really helpful to hear. Thank you. We're going to jump to, you gave us a little preview of the next part, Alex, so we'll jump right to engaging with partners and providers. And I'm going to give you just a little bit of a preview of that, and then I'm going to hand it over to Nina. And so the preview really is around what we have found when we've read the different state and territory lead agency detailed reports. So the National Center on Subsidy Innovation and Accountability reviewed every detailed report published by lead agencies between 2020 and 2023 and found fantastic examples of reporting data. However, what we also found was that very few reports included how the state and territory engaged with partners and providers in the process and how they used that information they gathered from those partners. And we know that by talking to you, that you're doing some fantastic work with those partners and providers. And that is really important to reflect in your report. It's helpful for the partners to see themselves in the report and how you use their information. And it is also a requirement of CCDF. So I am going to go to the next slide and hand it over to Nina.
Thank you, Heather. And yeah, it's so impressive that you reviewed all of the reports. I still can't get over that, but I love it. So we're just going to go over a few reminders for reporting on engagements. The lead agency must engage appropriate entities prior to conducting the studies, regardless of whether it's a market rate survey or an alternative methodology. And it's good to continue engagement throughout the process. So as Heather said, you all are doing a lot of this great work. Just be sure you're documenting it. And then reporting on how you conducted this engagement helps your partners and providers see themselves and their contributions in your report. So that's one of the reasons it's really important. It's important to include not only that you collected feedback, but what you did with that information once you had it. This helps partners and providers see how you use their feedback. And just as a reminder, lead agencies must engage their state advisory council or another similar coordinating body, local child care program administrators, local child care resource and referral agencies, organizations representing caregivers, teachers, and directors, and any other appropriate entities. So there's some additional information regarding engagement that's helpful to include in your report. First, describing how the providers you engaged represent the population of providers can help providers reading the report understand who you engaged and how or whether those providers might understand their needs. So they really want to see themselves represented in your work. Second, it would be helpful to describe ways in which you ensured engagement. So this could include something like translating information or holding meetings at various times, including evenings, to ensure opportunities for a variety of providers to provide their feedback. And you can add this information from your report to the CCDF plan.
Okay. So I want to jump back to Rebecca and Alex and talk a little bit about how you engaged and responded to your partners and providers and how you summarize that in your report.
Sure. Part of this, Alex talked about our kind of story and our journey. Another, big kind of piece of that is a transition that took place in Virginia in fiscal year 22, but in July of 2021. So DOE, the Department of Education in Virginia, became the lead agency for CCDF, effective on in July of 2021. That oversight was transitioned from our partners at the Department of Social Services to education, really with the intention of unifying all childcare and early education programming under kind of one roof, one agency, one board. And as part of that transition process, we did a ton of engagement with partners at kind of every level and with varying perspectives, including providers, local departments of social services that do eligibility for our subsidy program. We spoke with local leaders, with school division leaders, you name it. We were really kind of deeply engaged and committed to hearing from the broad range of partners and colleagues in the field to understand, how they saw early childhood in the state, what were some hopes and aspirations for the future that they were wanting the department to keep in mind as we were moving through this transition process. And one of the things that we heard very clearly was that payment rates in the subsidy program were a problem and were disincentivizing providers from participating in the program. And that came up loud and clear from multiple different types of stakeholders, and so we knew well before we really kind of started on this process and before we got the directive specifically from our General Assembly to develop an alternative methodology that something needed to be done here. And then so we took on the process of initiating the pre-approval. And then as we were undergoing that process and beginning to think about developing our model, we sort of did a simultaneous set of stakeholder engagement conversations so that we could talk about some of our assumptions, the kind of main cost drivers that we were intending to account for in the model, and then the ways in which we were thinking about using that information to set payment rates. I think something that was important, and I'm jumping ahead to kind of one of the other questions in terms of things to keep in mind, is that we're really intentional about trying to focus our conversations with partners on the how. The what is really important, right? I mean, we ultimately providers want to see and are expecting, a meaningful impact on their payment rates through this process. However, we're never going to make everyone happy. And there's really no way for us to create a model that accounts for, that is going to spit out a number that works for everyone. And so, we tried to really focus our engagement and our conversations again around the how so that we could get buy-in on the process and buy-in on the approach, recognizing that there's always going to be a little bit of variation and satisfaction with the actual outcome. But if we can all agree on the methodology, and if we can all agree that these are the right drivers, the right assumptions, the right levers, then we can make steady progress on the what over time. And so just I think that was a really kind of foundational approach that we took with our engagement process, and was important for us in the way that we engaged with every kind of partner, right? I mean, we took that approach, whether we were talking with providers, whether we were talking with financing experts, whether we were talking with directors, with our local departments, right? We were really focused on the model itself and the assumptions that were driving the model, and focused a lot less on this is what the actual rate would be, right? So it was more about like, this is the model, this is what our assumptions are, and this is how we would use it to set rates, and less about the rates themselves. And then in the report, we definitely we talked about both phases of that engagement, and we talked about kind of what led us to conclude that this was really the direction that we needed to take. but also talked about the different partners and the kind of broad reach of these sessions. Ultimately, we had nearly 400 individuals that participated in our engagement sessions over the course of the process. And they were, represented, advocacy organizations, represented individual kind of provider membership groups, different types of providers, of course, our state advisory body, some state and federal experts on financing and early childhood policy, just to kind of get, the sort of broader, higher level perspective on our approach. Childcare resource and referral, again, our local departments who do a lot of interfacing with providers and families, as well as we did a kind of a full town hall on our alternative methodology as well. Also, just for context, we were approaching this rate setting and alternative methodology process at the same time that we were overhauling our co-payments. And so we were able to really talk about those things in tandem in terms of improving payment rates for providers, but also making childcare more affordable and accessible for families, and how those things are two sides of the same coin and work together to really achieve the outcomes that we wanted to see. And then there was something else that I was thinking I wanted to mention, but it kind of left my head. So I will stop there. And Alex, not sure if there's anything you want to add here.
I wonder if you were thinking, Becca, because when you're talking about the co-payments and the rates together and those being two sides of this same coin, where my mind tends to go along with that is the policies that enable providers to access that maximum reimbursement rate. Okay, so that's probably what you were thinking about too. So something that we have talked about with some other partner states who've been considering going down this path with the alternative methodology, and I know this came up some at STAM last summer, is, it's all well and good if you raise your reimbursement rates, and, especially if those are significant or meaningful shifts in those rates, as we saw, especially for, infants and toddlers in Virginia and some of our really rural parts of the state where the market rate is frankly just was extremely low. If the policy in your state is such that a provider can't achieve or receive that maximum reimbursement rate unless it's what they're charging in the private pay market, then what you might unintentionally do is price private pay families out of their childcare programs. And so we had that policy in place in Virginia that a provider could not receive more reimbursement than what they were charging private pay families when we were using the market rate. When we moved to the alternative methodology, and again, fortunately, the language of the budget and the directives from the General Assembly said that the rates should be reflective of the cost of quality, and that allowed us to kind of move away from the requirement that we hinged this upon what providers were charging. And so we made sure that we really messaged that to providers and other stakeholders and partners that this maximum reimbursement rate is the rate the state pays. If you charge something greater than that, it is your personal business decision whether you want to charge the difference. If you charge something less than that, you may still receive this maximum reimbursement rate. Because again, we didn't want providers to be like, oh gosh, I've got to double my infant rate now if I'm going to be able to get the state rate. Because as anyone who has infants in childcare knows, it already feels like as a parent, you're paying absolutely every dollar you can afford. So we did not want to, again, have any unintended consequences for Virginia families.
That's helpful. Did you have, in this engagement, and I'm racking my brain of your report at this point, any bumps that you want to share around engagement and kind of having that shared vision with your partners? And you may not have included it in your report, but if you would, you're reflecting now, what would you say about those bumps?
I wouldn't describe that us having experienced any bumps necessarily. Again, I think we had the benefit of just an enormous amount of data and input kind of already guiding our approach to the process, such that we felt pretty confident in the direction that we were taking things, before we really even kind of formally embarked, on the pre-approval process or the development of the model. I would say, I spoke a little bit, so when we're really focused on the how, both in the terms of the model and then the how would this be used to set rates. And Alex spoke to the really important point around these rates being available, regardless of what you charge your private pay families, because that was one of the most frequently immediate questions that we got, right? Like as we're talking kind of before we got to the point where we said, this is how we're going to make this work. Immediately the concern is this is going to raise rates for private pay families, or does this mean that I'm going to have to increase my rates? And one of the pieces of feedback that we did get, because originally, so the way that our model works is it generates for centers, age specific payment rates, and they differ, based on the age group of the child. But for family day homes, because we assume a mixed age setting, and for family day homes, it just spits out one rate regardless of the age of children. And so we had originally intended to set, Alex, I believe it was all rates for all ages at 75% of the estimated cost of quality. And so we were going to use, all ages at the same level, but not at the full cost. And 75% is also where we were intending to set centers. And we heard from family day homes that there were some concerns that using that very kind of level approach and not at the full cost of quality was going to disincentivize providers from serving infants and toddlers. And so in response to that feedback, we ended up doing more of a graduated approach where we still did it by age, but infants were paid at a higher percentage of quality. Or per percentage of cost, and then it was kind of went down as age increased. We've actually since moved to reimbursing family day homes at 100% of the cost of quality for all age groups, which I think feels a little different because at that point, right, if they know they're getting reimbursed for the kind of full estimated cost for an infant, it's not quite as disincentivizing as when we were thinking about setting it at lower than the cost of quality. So that was one piece of feedback that we got, that we, did some additional kind of analytics and thinking about, and ended up making two adjustments to that rate accordingly. I think we made the first change in October of 2022, and then the bump to 100% across the board in August of 2023.
Great. Thank you. That is helpful, because I think a lot of people that are on this call, you have bumps, or you have things that you need to consider if you're using a market rate survey or a cost-based alternative methodology, and understanding how you use that, but also address that is really helpful with your. So thank you. We're going to jump to, just so we don't run out of time, hopefully, we're going to jump to the narrow cost analysis. So I'm just going to do a quick preview of what we're going to hear about, and then I'm going to again turn it over to Nina. So all state and territory lead agencies are required to do a cost analysis. If you're using a market rate survey, a narrow cost analysis would be additional step. If you're using a cost-based alternative methodology, as Virginia had, you might incorporate the requirements of that cost analysis within your alternative methodology. And so it might seem that it's all blended together, but we have actually separated it just so that we can be very clear that those have separate requirements. And so I am going to hand it over to Nina.
Thank you, Heather. So the report must include the cost at the base level and at each level of quality, and then also any relevant differences in cost, including geography, type of provider, and age of children. And then I'll just talk briefly about elements that would be helpful to include. So these elements are helpful for report readers and will support you in responding to the CCDF plan. So it's a win-win. Summarizing the methodology for estimating costs, explaining how the data represent the child care market, including a definition of base level care, and then also definitions of levels of quality, including costs comparable to subsidy rates, meaning if you pay subsidy rates monthly, the cost would be reported monthly by child. This makes it easier for you and for the readers of your report. And then finally, noting the gap between the cost and the subsidy rate. And this information can help report readers better understand what providers would need to support the cost of providing childcare. I'll turn it back to you, Heather.
Thanks. So again, we have an example that Massachusetts kindly gave us permission to share with you. And this table represents the differences in cost per child in a family childcare home in Massachusetts. It shows the cost for the entire program per region per year. And this is for the base level. So as Nina shared, you would want to look at the cost at the base level and at levels of quality. Also, Rebecca and Alex shared how they've done that in Virginia. And so this table is one of multiple, and this one's for family child care at the base level of care. And then it also breaks down the cost by age category by day. And so in Massachusetts, their subsidy rates are by our daily rates. And so this is a comparable rate to the way Massachusetts pays. So this is just one visual example of how you can represent all of those differences in a simple table. Thanks. And I'm going to jump back to questions for Rebecca and Alex. And first questions really are, how did you incorporate those components and those requirements into your methodology and in your report? And again, and this might be a duplicative question for you, so feel free if it is not to answer, but what it was important for you to include in the report. And I definitely heard salaries. So anything you want to add there?
Yeah. So as far as how we incorporated or reflected the narrow cost analysis into our report, as I mentioned earlier, we really thought about this kind of largely in the vein of compensation. And so we assume across the board that under any scenario, providers are meeting basic health and safety standards that are associated with licensure in Virginia. And we primarily made that assumption for two reasons. So one is that our subsidy regulations for child care centers are quite comparable to our licensed child day center regulations. There are very few differences, particularly differences that would have a big cost impact in those regulations. And so because those are so similar, and the vast majority of care in Virginia in our subsidy program is provided in centers, we felt like that kind of licensure as a baseline was appropriate. And then while there are some differences between the subsidy regulations, so we have kind of a few different categories of care that family day homes can fall into. We call home-based providers family day homes in Virginia. You can be licensed, you could be regulated, but not participating in subsidy, and then you could be regulated and participating in subsidy, and sort of the layers of oversight, increase with that. With licensure being kind of the highest threshold. Okay. However, the vast majority of care provided in our subsidy program, even among home-based programs, are licensed home-based programs. And so we still use licensure as sort of the baseline in thinking about the default versus the high quality scenario. We do have a separate model for our small unregulated programs. The threshold for licensure in Virginia is 5 or more children. And so we have a separate model that assumes providers are meeting health and safety requirements associated with subsidy if they're regulated, and a small family day home. Okay. So that health and safety really served as our baseline. And in thinking about salary for the baseline, again, we used some slightly outdated but adjusted for inflation workforce data. to be able to report salaries for family day homes, lead teachers, assistant teachers in both settings,
Mm-hmm.
As well as directors and assistant directors in center-based settings. And that is intended to kind of capture like what is the status quo of
Mm-hmm.
wages in the childcare in childcare settings. And so if we were to continue to reimburse providers to kind of meet their current costs, right? That's sort of what we assume the default scenario is.
Right.
And then the high quality scenario is based on those K-12 salaries that we imputed from the staffing survey. And so we account for the regional variation in cost in our high quality scenario, but we weren't able to regionalize the salary data that we had for the baseline. So we do just report state level comparisons between the two scenarios, but our actual, again, our high quality scenario and then our actual payment rates are regionally based and account for regional differences in cost, largely focused on salaries. But then also we did sort of a modified, the Department of Education has a mechanism for adjusting K-12 per pupil rates for some of the higher cost of living areas in the state. And we modeled our non-personnel cost adjustments on that approach. So as much as we could, we were trying to mirror the ways in which K-12, or I guess I should say pre-K-12 settings are funded in Virginia, at least from like a structural standpoint, while making it appropriate and applicable to the childcare context. And then, of course, as I mentioned, we account for age groups in the context of the center-based model based on our licensing standards. But that doesn't change. There's no change in age groups, no change in, ratios or group sizes associated with quality as the way that Virginia defines it. It's all really rooted in that compensation piece. We did add a couple of additional variables in the higher quality piece as well, around additional paid time off, additional professional development opportunities. But again, those pieces are all really focused on that kind of staffing and the supports that are going to contribute to higher rates of retention over time. And currently in Virginia, there are just 3 levels of quality in our new measurement and improvement system. We have a needs support, a meets quality expectations, and an exceeds quality expectations. And our model, the kind of high quality scenario, is assuming that you are meeting or exceeding expectations. As we continue, so this year right now is the first required year of participation in our measurement and improvement system for all publicly funded providers. As we continue to get more data and think more about what does it look like to exceed expectations? Are there commonalities? Are there things that are shared among those programs? We'll use that data to refine our model looking ahead and think about, are there kind of additional ways that we want to account for different levels of quality in our system through our cost model.
Great. That's helpful. Thank you. And did you, in all of this, I imagine this is really complex for policymakers, for partners, for providers. Were there visuals, charts, specific information that you really focused on? I mean, I heard Alex earlier talk about the shared vocabulary. There are other aspects, like I said, visuals or other things that you use that you might recommend, an approach for other lead agencies around your report or sharing the information?
Yeah. Do you want to take that one back, or you want me to?
Go ahead.
I was both on mute. I was like, oh. Visuals are definitely helpful, especially where I think, where a visual is called for, right? So Becca spoke quite a bit about our regional model and how rates were set aligned with our 9 ready regions, because as is the case, I imagine just about every state, cost of living and earnings vary quite a bit in different parts of the state. So we had, the map, for example, that showed visually each of the regions and labeled, so people could see, okay, this is ready region number 1. This is also called Southwest. And then because later when we have the data broken out regionally, folks may just want to orient themselves to that region, right? So I think maps could be helpful if a regional component is part of your rates. And then, of course, tables, I think, are a nice way to visualize either prior rates and new rates, or showing what has changed, breaking it out by provider type, by region, by age group, some of those different meaningful ways that you disaggregate the data, or some of those big drivers that affected the rates. But I think, like, in addition to the visuals, something that we thought was really important, and I did mention this a little bit earlier too, is not just the what, but the why, right? So like we did a good portion of the intro of the report trying to build that context, all the things that Rebecca mentioned, the market failure, why the rates are needed, the competitive compensation, the alignment with quality, the move to a new state agency, how all of these pieces intersect, I think are really important in telling the story of, again, why now? Why is this happening? And making it really clear that there was a lot of intentionality and a lot of voice that was incorporated into this report, and so bringing back up the survey data. And I think it's, the research makes it really compelling, being able to say, we have data to show that compensation is a key driver in retention or turnover, that we had data to really show that on average, our subsidy providers are paying their staff $2 an hour less than non-subsidy providers. And, when we think about family choice and access and options and quality, those are hard numbers that really, really matter. So that's why we really just try to emphasize, again, a lot of that context and how these rates can shape provider participation in the program. They shape the out-of-pocket costs for families, the quality of life for the staff that are looking at these programs. It's like every level of the system.
Yeah. I do think, we've talked a little bit about trying to create some like little more snippety one-pager type resources. We have not yet gotten to that point, but that is probably a place where we're interested in continuing to build out our suite of resources. We borrow from our report all the time to make slides, to make, other kind of informational resources, but we have not created any kind of beyond what Alex was describing of things that are actually in the report. We haven't created a ton of one-off resources. I did want to speak to Lori's question in the chat, if that's okay, Heather. So something that, we actually haven't touched on yet, Alex did speak to, we were really clear up front that our payment rates were going to be available to providers regardless of what they charge private pay families. Another thing that was really important to us, and a decision that we made up front and communicated to providers up front before they even knew kind of what the rates were, was that our rates were going to be based on our high quality scenario, regardless of what your quality level was in our system. And that is based on sort of again, like a philosophical approach where we wanted to, so if we're going to set these, universal standards for health, safety, and quality, we want to fund our providers to meet those standards, and not only give them the funding to do that until they've already achieved those levels of quality. So it's a little bit of a shift and a little bit of a different way of approaching payment rate setting. So in Virginia, all providers are paid, the same rate, regardless of where they fall on our quality measurement and improvement system. And that will remain true, at least in the immediate near future. I mean, we are still thinking about, and again, won't make any decisions until we really have an opportunity to dig into the data and probably have multiple years of data to look at. Over time, we may consider making adjustments or having other ways that providers that are really exceeding quality expectations could be supported, or providers that are looking to do kind of additional, looking for additional supports or strategies to support competitive compensation or other staffing supports. But we really wanted to make sure that our rates were rooted in the expectations that we were setting.
All right. So, back to her question around, right, like laying out your levels, it sounds like you're, from the rate perspective and this perspective, you focus on the high quality, so you don't see those definitions. I'm assuming, in other areas of your systems, you might actually lay out on
Yes.
your website those quality levels, but from this perspective, you just went straight up to the high level and said,
that's exactly right. Oh yeah, we've got lots of information about the different levels of quality and what it takes to achieve those different thresholds in our system. We just very intentionally don't tie those to our payment rates.
That's helpful. It's helpful to know. I think that is, I think there are some other states that do that, but it is a unique perspective of paying people so that they are able to achieve those levels because they have those funds to be able to do that. And so I know we're running out of time, and I know you guys probably have other places to go along with all the other participants, but I want to give you both an opportunity really for your last word around what recommendations do you have for others, or just any thoughts that you didn't get an opportunity to share that you want to share. Whoever wants to go first.
I can jump in first. I mean, I think we both have said multiple times, and one of the biggest pieces of advice that I think we would offer is to really make sure that as you're kind of going into both the development of your approach, but also the creation of your report, that you're really grounded in your why, and making sure that that is clear to you, to your stakeholders, as well as to the audiences that you're speaking to in the context of your actual kind of written products. I think in a lot of ways that why is just as important as the how, and arguably kind of more important than the what, right? I mean, the what is something that can evolve over time as funding contexts change, as additional resources are available. But if you don't have a really strong, rationale and approach up front, then it makes it harder to get to the ultimate destination that we're headed for, which is really sustainable payment rates for providers in our public system. And so, again, I think that's kind of one of the biggest recommendations that we have, that I think has served us really well at every stage in our process. And then I think I would also just say, don't overcomplicate it. I mean, we definitely have the very technical kind of pieces of our report that, again, we're grateful to have the expertise of folks at prenatal to 5 fiscal strategies support us in creating. But the actual, I mean, if you can take a look at our report, it's brief. It is, pretty straightforward. There's not a lot of fancy stuff going on in there. But it gets our message across. It kind of communicates pretty clearly the requirements that are delineated in the law, but also achieves our goal of really communicating our priorities and how we achieved those things. And so, I wouldn't belabor the report process any more than you need to, because that it should be the least hard part of this whole journey of compiling these methodologies.
Great, thanks. And Alex?
I would echo that, especially like the least hard part piece, right? Like that should just be the final flourish. You've already done all the heavy lifting, the stakeholder engagement, the policy changes, the system changes. You've gotten the rates out to the field, and now you're just, summarizing what you did. And I agree that keeping it short and sweet for all the reasons we've talked about, thinking about the various and diverse audiences and users who will be reading this report is important. And again, I think for those who are moving into an alternative methodology, we want to make this seem like not so daunting, so that other states can feel confident coming on this on this journey as well.
Thank you so much. I want to thank both of you for joining us. We do have a few slides left, and I'm going to do it really fast. So to share, so there are some additional data required within that you'll include in your detailed report. This is not necessarily new data for you to collect. It's been required by the CCDF plan. What is new is to include it in your detailed report. And that is barriers reported by childcare providers to participate in CCDF subsidy, the amounts providers charge to families that exceeds the copayment, and the frequency of which those providers charge more than the copayment. And then some additional considerations are: consider summarizing your key points. Make sure you have them right up front for people to use. I heard this from Rebecca and Alex, write it in layman's terms, use plain language for ease of use for your partners, providers, and policymakers. And a requirement is that posting the report within 30 days of completion and make it available on the lead agency's website. Some key points that we heard are: make sure your report has the required components, make it easy to understand, use that, include that description of your engagement. I just heard from Rebecca and Alex, be grounded in your why, in your report, and don't overcomplicate it. If you want to share any of your key takeaways in the chat, I'd appreciate it, but thank you. And I want to remind everyone that technical assistance is available to CCDF lead agencies. We can individualize that so we can support you in your report, in your methodologies, in whatever your questions are. So you can do that by talking to your regional office, or there is a TA request form that you can use. And we're very excited to share that while this webinar series is ending, we are actually launching a cost data peer learning group where anybody who's working on cost data or wants to learn more about using cost data can come together. It's a discussion forum. We'll have some people coming to share what they might do, they have done or are struggling with, and then participants will have an opportunity to discuss their questions and ideas based on the topic. Our first session will be April 11th, and the topic will be finding data and analyzing the data. And an announcement will be coming out soon. And these are some resources. This slide deck will be available on the Child Care Technical Assistance Network website. So these links will be available to you. This is a link to Virginia's report and 2 of Massachusetts reports. And thank you everyone for joining us. I want to remind you, as you leave the meeting, you will get a pop-up for the evaluation. So please complete that. I do read every response, and we do use that information. And I want to thank everybody for joining us.